Why is no one telling you the real truth about mouth taping for sleep apnea? There's experts out there that are feeding you lies, and honestly, it's because they're not looking at the research, and that leaves them repeating the same surface level advice, keeping you from making real progress. That's why I'm here to share groundbreaking research that was published just a few weeks ago. So I'm going to walk you through what this research means for you, including a series of questions that helps you identify how to best use mouth tape even if you have severe sleep apnea and are using a CPAP right now. And in fact, I'm going to show you special exercises in a special step-by-step fashion that when used in combination with mouth tape can help you unlock quiet, refreshing sleep. Most importantly, this episode is going to reveal a deeper issue in nighttime breathing that mouth tape alone doesn't always fix, and how to address this root problem. And to first make sense of all of this, it's going to be very important for us to discuss how powerful nasal breathing is in overcoming sleep apnea once and for all. So before we expose the big lie about mouth tape and what's going on about that, and if it's something you should even try out, I want to tell you why mouth tape and what we're really aiming for, nose breathing or nasal breathing, is super important. So why breathe through your nose? Well, what else is your nose going to do at night? But no, seriously. So it has a lot of great things that happen. And here's an article so you can look at this and make sure I'm not making a bunch of stuff up. Nonetheless, here there's three major benefits. One, it's actually going to lead to more blood flow to your brain. So if you breathe through your nose, it will affect how blood flows through your body and more so in your brain, which is going to be better for you at night. Because if your brain has good blood flow, you can sleep better because sleep is a highly metabolically active activity that requires a lot of oxygen and nutrients to happen. If you're breathing through your mouth, then you reduce the amount of oxygen to allow good sleep to happen. So that's why if you breathe through your nose using mouth tape or other things we'll talk about in a moment, that will help bring more blood to your brain for good, healthy, effective sleep. Number two is more nitric oxide production. That will allow for more blood flow, yes, to your brain, but also everywhere else. Because when you breathe through your nose, the movement of air through this part of your nasal cavity, because we're looking at a cross view of your head. If we cut it in half this way, very pleasant, I know, looking from the side, that's what this is. When air flows through here, this produces nitric oxide, which is a molecule that will cause a lot of vasodilation, which is a fancy word for making blood vessels and also some airways bigger. That allows things to move. That's like going from a 2-lane highway to a 5-lane highway. Now, if you're in LA, that still doesn't fix the traffic problem, but in your body, that will allow things to flow more easily. That's another big benefit of nasal breathing. And then the third one is less inflammation. And the reason for this is because if you breathe through your nose, this will humidify the air for you. And if you're someone who either lives in a dry place or maybe use a CPAP and you don't use a humidifier, maybe if it's just broke on you, then you know what it's like to have a dry, inflamed airway in the morning. And also, if you're breathing through your mouth, you will have a dry mouth in the morning, but it's also inflamed. So by breathing through your nose, you reduce airway inflammation, and that allows everything to work a lot better, whether it's natural breathing at night or also if you're using a CPAP. So that's why breathing through your nose is of the utmost importance. Now, to get there, there's a lot of different ways, but I want to clear up the big lie about mouth tape that just keeps getting perpetuated. So once again, I always bring you the receipts because I just don't want you to believe me at face value. I'm just showing you things and it's up to you to decide what you want to believe. So first is the age-old question, is mouth tape dangerous? So let's ask the experts, and this is the first thing that will pop onto Google, which is probably going to be the majority opinion. And this is by some doctor. I don't say that in a mean way. I don't know who this person is. I just don't literally know them personally. But what they say is that this is nothing a physician would ever recommend to a patient. They also say mouth taping is not safe at all. Okay, that's the expert opinion. Is that based on anything? So I actually looked into this quite a bit. So if you look at some of the mortality data, because every year the United States publishes the data on what everybody in the United States died from. Yes, it's not going to be perfect, just like any data set would be, but they give a good level of accuracy. If you go through this, especially this one, suffocation injuries in the United States, patient characteristics and factors associated with mortality, which is a very pleasant read If you have kids and you want to read them a bedtime story, I would avoid this. But if you go into here and if you search for the word tape, mallet tape, etc., nothing comes up. And if you actually read the paper, you'll also find that most of the suffocation injuries are actually from eating food in bed. And I thought this was silly, but I've had one quick story when, doing a rotation in the emergency room. Someone came in 2 a.m. because they were choking on catfish. Yes, I live in the South. Yes, that's weird. But also, it's what happens. Most suffocation injuries are related to food, not to mouth tape, not a single one. And in fact, if you search for mouth tape or other different permutations of this, like porous oral patch, you will find no case studies on deaths about this. And what you need to know is when there's a case study that can be made about anything, it will always happen. And the closest are people who committed suicide using exclusively duct tape. That's the closest thing you'll find. Nothing about mouth tape as you'll see on TikTok, Instagram, or anywhere else. Nothing about that. So when I search all these different databases, that's when I gotta ask, like, the people hurt by mouth tape, are they in the room with you right now? Like, where are they? There's really no evidence to suggest it is harmful. Now I want to say and be very clear. There may be some evidence out there. It may be absent. It may not be here yet. But the thing is, if it's been going on for so long, why can't someone point to one person who's been seriously harmed by mouth tape? Because what we'll see as we talk about this more, a lot of times experts, they'll just be saying stuff, not fully backed up by research and everything. You always want to be able to know, like, hey, what does the data actually say? And that's why when we look at research and journalism around this, this is another great example. This is a October 2022 article that mouth tape is dangerous. This TikTok trend is dangerous. That was October. October is known as the month after September, right? Well, what do we find in September? They did a study on mouth taping. So a month before, someone on CNN.com is saying mouth tape is dangerous. A month before that, they had a study in that, and there were 0 adverse events. And there was other studies even before this. So sometimes just also lazy journalism is going to get people. Not saying all journalists are lazy, but a lot of times health ones are. Because I bet you that this person who did this article on CNN probably looked at this person's opinion, and that's how things get to a level of we're just saying stuff in the world of health and not actually basing it on reality. Because when we look at different anecdotal evidence where people are saying mouth tape good or bad, and I will get into how you will know if mouth tape is good for you or not. Stick with me here. But there are going to be certain people from Reddit, etc., that say, hey, mouth tape's great. Mouth tape worked well. We can't discredit that. Yes, I am now recognizing I am using Reddit as a source, but it's to prove a point that there's anecdotal evidence of people's individual stories we cannot ignore. Yes, we're going to get into research literature on it, but at the same time, we have to appreciate that there's going to be a grain of truth, and we don't want to just settle for just one opinion. Because when we look at the pyramid of evidence here, we will notice that editorials and expert opinion, this is at the bottom. And that's what's at the top of the search results. Because whether it's case reports, that could be the Reddit things, people saying, hey, this is great, or these studies we're going to get into, we're a lot higher on this pyramid with mouth tape than we think we are. So just as a health aside and me kind of soapboxing and some nice Orwellian health related topics, when they're telling you to reject all other evidence and just listen to me as the expert, that is the least scientific thing you can ever do. You need to look at all available information and synthesize it for yourself. That being said, bottom line, there is no evidence right now to suggest that mouth tape is lethal. Now, the bigger question is, okay, it's not going to kill me, but is it actually going to help me? And how do I know if it will help me as a person? Let's dive into that right now. So in talking about mouth tape being effective, there's a lot of studies out here. So here's this one study titled Mouth Tape for Midnight Quiet, a groundbreaking study on partner talk reduction. And this was done at the Institute of Peaceful Sleep at Yombridge University by Dr. I.M. Sleepy and Dr. L. Let Me Rest. Really great scientists, very esteemed. And in a double-blind placebo triple bypass study, they found that the effectiveness in mouth tape actually led to less annoying things said by your partner at night, a huge reduction from 80% to 10%. Now, hopefully by now you've caught on this isn't a real study. This is just my pulse check because we're about to have a science snooze fest. This is necessary to know how to apply what we're doing. So stick with me. This will make all the difference for you here. So there's a few studies we're going to go over and what they mean for you. I'm going to make this real quick, real painless. Here's a study from September 22 that CNN.com, just didn't want to even read. But what they found here, 20 patients, and they found that mouth tape was able to reduce AHI from 8.3 to 4.7 and made some differences in different sleep metrics here. Now, if you have moderate to severe sleep apnea, stick with me. This still applies to you. I'm just going over some evidence, okay? So stick with me. Don't leave. I'm going to show you how to use mouth tape even if you're more severe. Once again, back to this study, what they found was that, once again, before they were over here, a little bit higher in terms of their sleep apnea severity, and with mouth tape, they went a little bit lower. Now, what's really important are these whiskers. So this is a box plot. These are known as whiskers, really cute. Nonetheless, there's a lot of variation, very wide whiskers on these box plots. And when you look at the individual data here, and once again, we'll make statistics exciting for you. So on the bottom here of this graph, this represents where people were with their AHI before. So all the people up and down here, like all these points on the right, if I zoom way in, all of these people had an AHI of around 15. And where they are on this graph actually tells us what their reduction was in their AHI using mouth tape. So let me walk you through. So all these people over here on the right had an AHI of 15. If you look at my mouse cursor. This little piggy, this little dot down here, they had a reduction of 10. That's how you interpret this graph. So this person went from 15 to 5 with mouth tape. This person had a reduction, looks like about 7.5. They went from 15 to 7.5. So on and so forth. So for instance, over here, this person was at 10. They had a drop that probably looks like around 9. So they went from 10 to 1. Now, that's not the case for everyone. So you have someone who's over here around 6, they actually went up by 3. You have this person, no change. Well, relatively, these people are kind of no change. So overall, most people had some improvement. Their AHI decreased, but there was a lot of individual variation. I'm going to show you why that is. This is really, really important. People have an individual response to mouth tape. This is like this is the thing to know. And this is something that's been found again. Because one thing about science is cool, you did it once, can you do it twice? And this is actually the older study. I wanted to show the newer study because I talked about it before, but this is a older study, and they found something very similar. It took people from around 12 to about 8, but once again, we call this a spaghetti plot because they're made exclusively in Italy. No, because it looks like a bunch of spaghetti on a plate. And this will show us what the changes are individually. Now, I know this is getting boring, but we're almost done the boring part. What this shows is that, once again, there's big individual variation. So if we look at, where's my axis here? So we have, say, this person who had a big change. Where'd they go? They went from 14 down to about 5. That is mild sleep apnea on the edge of moderate, basically to no sleep apnea. That's huge. But you also have this person who, where are they? They went from about, I think, 15 here down to like 13. Not really any different at all. So there's an individual variation. So the bottom line here is, once again, against the lie you get told there's no evidence that mouth tape does anything for anyone. That's just a lie. That's just straight up a lie. I just literally showed you that that's not true. But the nuance here is it works for some people, but not for others. So that's why the big question is, well, what determines if it works? And what if you have moderate or severe sleep apnea? So that's why I want to talk about, who does this work for? If you've seen Austin Powers where he's like, who do you work for? That's what I'm joking about. And that's what also leads us to the latest and greatest research about breathing through your mouth versus your nose. So this one is super fresh, October 2024. And what they found in this, and this is a very prestigious journal, if you're going to publish a paper about breathing through your mouth or nose, this is going to be the journal. This is the journal that all ENTs should be reading on a monthly basis. So what they were looking in this research was, what is the role of mouth breathing versus nasal breathing in obstructive sleep apnea, and how does this affect airflow? And what they found was that closing the mouth improved overall airflow, but If it was in patients who were heavily reliant on mouth breathing due to nasal obstructions and other problems, this actually made it worse. So this is our divide. This is the moment where we can decide mouth tape, should you try it or should you avoid it, do something else, and then maybe use mouth tape in the future. This is like the holy grail of using mouth tape or not, because it allows us to sort out what path should you go on. If you're someone with okay nasal breathing, we have options for you. If you have bad nasal breathing, we have options for you. If you're on a CPAP, we're going to go over steps for you. To determine that, we have our nasal breathing readiness table. So this is something that I'll use with our clients if I'm speaking to them one-on-one, trying to figure out where they fall along the spectrum. And so there's going to be a series of questions here. So if you're going to use your fingers to count, you can do that. If you want to get pen and paper, because we're going to add up, we're going to do some high level math. I'm talking about 1 plus 2. It's going to be crazy here. You ready? I'm going to ask you questions. It's a simple yes or no. Question 1. Do you often feel congested or find it difficult to breathe comfortably through your nose? Yes or no. Number 2. Do you frequently, and that one's 3 points. So if you got yes, then write down 3. Question 2. Do you frequently wake up with a dry mouth or throat? Yes or no? And yes is +1. Number 3. Have you been diagnosed with a deviated septum, nasal polyps, or chronic sinusitis, and you have not had that addressed with any sort of surgery that actually helped? If the answer is yes, you get 4 points. Sorry. This question. Do you often notice yourself breathing through your mouth during the day or while active? You put yes, and that's 2 points. Have you been told that you snore loudly or have frequent breathing pauses during sleep? Or maybe if you record your snoring, you have very high snore scores. If the answer is yes, you get 3 points, my friend. Now, this next one is going to be different than all the other ones, so just pay attention. This one's different. So if you get no, that is what gives you points. So the question is, can you comfortably breathe through each nostril when you close the opposite one, as such? If the answer is yes, you get 0 points, which is good. If you answer no, then you get 3 points. So if it's uncomfortable to breathe through each nostril individually, then you get 3 points. Next question. Do you experience nasal congestion that changes from one nostril to the other during the day? If yes, you get 2 points. Last one. Do you notice difficulty or discomfort when you try to breathe exclusively through your nose while trying to keep your mouth closed? Or when you first lay down in bed is another good area to think about. If yes, then you get 3 points. If you need to add these up, you can pause. That's the beauty of YouTube. Now, what does all these points mean? Well, let's talk about that. So 0 to 4 means you're okay. Doesn't mean you're great. There still could be some issues. Means you're okay. Mouth tape can be tried. Really, more than 4, we got to have our own separate discussion and learn how to do certain exercises so that mouth tape can actually be more beneficial. Because the whole point we're trying to figure out here is, are you a person who relies too much on mouth breathing? If you are, then as the study suggests, closing your mouth can actually be detrimental to you. So we need to reduce the reliance on mouth breathing, improve nasal breathing before you try mouth tape. But if you're okay, then you can get even better. So for those points 0 through 4, including 4, this is what we're going to do. And all of this, I'll have all this in a guide for you. And so here's a step-by-step here for you on this. So you're going to select a comfortable mouth tape, and I'll have a whole list down here that you can screenshot, write down whatever you need there of, some brands that I like and I think are good. So select one. And then you actually do want to, clean the area around where the tape is going to go. And then whatever you need to do for the tape, peel it, cut it up, whatever you got, that's what you do. And then you just put it on before you go to bed. Now, I would recommend if you're doing this for the first time, don't do this just immediately before bed. Maybe half an hour before bed, get comfortable with it. And if it's extremely uncomfortable, then then you need to do the exercises I'm going to tell you about so that it becomes comfortable. And then quite simply just put it on and you just use it at night. It's that simple. Now, this video doesn't just end here, use mouth tape and you're good forever, because I am going to talk about how to get off of it in a moment, but it's just as simple as that. Wash and dry, put it on, and then just wake up the next morning, take it off. If it's too sticky, one thing you can do is put, And again, this is going to vary. You can put a little bit of like rubbing alcohol on the outside of it. Yes, that'll smell and all that stuff, but that will reduce some of the adhesive there. But again, if you're chemically sensitive, make sure whatever you're using is minimized in chemicals. Now, for those who may ask, is this going to be like this forever? We're going to do a little bit of a detour here because this is really important for the people who want to wean off and not use mouth tape forever. This is also important for the folks who their nasal breathing isn't strong enough to fully benefit from mouth tape yet. So, slight detour, we'll come right back to it. You know me. Main question, why does mouth breathing happen anyway? And is mouth taping literally just a band aid? Those are the big questions we need to answer. But first, we need to understand breathing fundamentally. And to this, obviously, the only answer is to go to YouTube. Well, I guess I'm showing a YouTube video in YouTube. This is very meta. And so your lungs are encased in this chamber known as your chest, and it's actually something known as negative pressure. When she's going to pull down on the diaphragm, it's going to cause negative pressure to build up like a vacuum. As a result, your lungs will expand. Let's see this. So it's somewhat subtle, but when she pulls down on this, the balloons get bigger. So watch that. That's how breathing works. In a closed container, when you pull on it to make it bigger, it creates this space, and the molecules have to kind of spread out, and that creates negative pressure. Now, a lot of people remember negative pressure either from physiology class, which may or may not be you, but also when everyone was like hooting and hollering about negative air pressure during COVID days. And negative air pressure is when you force air out through one end and then passive airflow comes in through another because now there's this negative air pressure here. It's a little bit of a tricky concept to get, but just think of it where you have this air in this space right here, and if I use something to remove it, okay, I get rid of it, there's this empty space here that is going to get filled by other air. All right, that's how that works. So that's how breathing fundamentally works. And the reason we need to know this is because sleep apnea fundamentally is a fast, irregular inhale that creates negative pressure in the back of your airway. Okay, it creates negative pressure in the back of your airway. As a result, this will pull things like your tongue, your soft palate. It will pull those tissues and more into the back of your airway because there's this negative pressure. And once again, this is something well established, not just talked about a whole lot. Again, if you want to read a whole paper on that, go have fun with that one. And when there's too much negative pressure from fast, irregular breathing, which is what this paper talks about, this will actually force the mouth open. Say that again. When you have a lot of negative pressure from fast, irregular inhale, this will force the mouth open. And thus, you become a mouth breather. So people will usually think of it the other way, of where they're thinking about the problem at the nose or the mouth level. But the problem is really from how fast you're breathing, how steady you're breathing. And if that's off, it's going to pop your mouth open. So it's the opposite. That's important because that allows us to actually fix it. Now, by definition, mouth tape is just preventing the mouth from being forced open and tries to just continue to force nasal breathing. Sometimes you can get away with this, sometimes you don't. And the mouth tape comes off. Simple as that. But the mouth tape, again, is just a band-aid. Now, I'm not going to say this in a bad way. It can be a great tool to bridge and get to a place of where you're breathing through your nose. But this is necessary to know if you don't want to use mouth tape forever, or if you're someone who can't use mouth tape and wants to treat the root cause a little bit more. So if you want to use mouth tape for that last little bit to overcome that last little bit of the breathing problem. So in summation, fast, irregular nighttime breathing equals mouth breathing. Slow, steady nighttime breathing, nasal breathing. This is what we want. Slow, steady, nasal breathing. All right, so thus concludes that detour, and now back to our regularly scheduled programming. So in weaning off, or really making any changes, it's always super important to have a great baseline in knowing how the heck you're doing. And a lot of that revolves around using a sleep tracker of some sorts, whether it's a Whoop, whether it's an Oura Ring, Snore Labs, just track with something, and the exact method of tracking is outside the scope of this video. If it was in the video, we'd be having like a 75-minute video. Just use some way to track, and you want to track when you're using the mouth tape. And bonus points if you track without mouth tape, and then you put it on, see how you're doing, and then also you want to make sure that you can then track again and know how you're doing without it after you've used mouth tape for a while. So have multiple baselines there. That's what you want. And when you're tracking, this then allows you to know if you go without it, are you doing the same? Because if you are, then you can stop using it altogether. You've retrained that last little bit of breathing. If you do worse without it, then you need to do some work on improving the musculature of your mouth and your lips, and also different breathing patterns. So in doing so you're tracking, and if you're not doing great without mouth tape, you get worse, you return back to a baseline, then we need to do some things. And there's some different checkpoints here, and one of them is going to be about nostril breathing, alternate nasal breathing. I've talked about it before a little bit. Let's go more in depth, shall we? So with this, you have two checkpoints. When you can do 10 minutes of this, that's checkpoint one. Checkpoint number two is to being able to do a brisk walk with exclusive nasal breathing or without any mouth breathing. So how you can start to train your nasal breathing is alternate nasal breathing. It's pretty simple. I'll walk you through it as follows. You're going to place your right thumb on your right nostril, close it off, and you're going to inhale. Inhale through the left, and then close that one off, and then remove the right one, and then you're going to exhale, and then inhale, close it off, take it off, exhale, and then inhale, close off, exhale, inhale, close, exhale, inhale. That's as simple as it is. I like to think of like a figure eight, like an infinity sign, if you will. That's what you're doing. And you want to do that for about 5 minutes when you start out, and then progress to 10 minutes. Now, I'll talk about ways to progress it even further in a little bit for people who need to strengthen their nasal breathing before even touching mouth tape. So that's what you're going to do. And when you get to a good level, again, when you're tracking here, then you improve your baseline on nasal breathing, and then that allows you to know, hey, it's safe, or it's going to be better. I'm going to stand a better chance of getting off of mouth tape and still having the same numbers, if not better. So this is one of the things you want to strengthen. The other things you want to strengthen, once again, if you can't get off mouth tape or your numbers worsen without it, is the puffer fish mastery checkpoint. We're about to look really silly, and I wish I could have found a picture to show you, but I just have to show you myself. So what this is training these muscles around here. So if you've ever played the trumpet, like I did for 2 weeks when I was 8 years old, got to very high. No, I wasn't good at all. God bless my parents for listening to that stuff. So you're going to puff your lip cheeks, if you will. Not this. We're not doing that. It is strengthening these muscles. And what you're going to do is try to make the air go in a circle in this space. I'm going to do it with air. Sometimes it can be easier for people if they use water. Air is a little bit harder, but water is fine. Now, if you're using water, there's the danger of you spitting out water. FYI, you've been warned. Okay? And you're going to go in this circle. Now, it looks weird. It makes weird noises. Yes. But when you do this, it'll start to strengthen your lip muscles. Because as you go about, let's do it again. When you're moving it around, you also want to focus on keeping your lips super tight. And if you do that for about 5 minutes, you will feel the burn, my friend. You will. And if you can do that for 5 minutes without having any leaks, none. And a leak looks like this. Just like you can hear the air come out a little bit. Maybe the microphone picked that up, maybe it didn't. I'm not going to do it again. I'm trying to preserve some self-dignity here. That's what you want to do. Okay, that's the puffer fish. So once you do both of these, this is going to tell you you can try to wean off and see how your numbers stay the same. Now, if you're someone whose score was more than 4, then we have different goals for you. Same applies if you want to use a sleep tracker to have some sort of baseline, and again, sleep trackers in depth. I'll put that at the guide at the end. but we won't talk about it in depth here. So your checkpoints are going to be a relaxed pause of 30 seconds, a max breath hold of 60 seconds. We'll talk about what each one of these means, don't worry. Unilateral nasal breathing, alternate nasal breathing, and then nasal breathing walk test. I'm just being more specific because when people are more severe mouth breathers, we want to have more things in place. So a relaxed pause, if we're going to do this together here, let me get a handy dandy stopwatch. So we're going to do something known as a relaxed pause. I call it a relaxed pause. Other people may call it a controlled pause. And it is how long can you comfortably hold your breath after you breathe out. So we're going to do inhale, exhale, hold your breath. 3, 2, 1, inhale, exhale, hold your breath. And you're going to inhale at the first sign of discomfort. If you're feeling a warmth build up in your chest, that's what that is. Sometimes people are around here, 10 to 15 seconds. And as soon as you feel that, inhale normally. And if you're having to overbreathe in that inhale, that means you went too far and you probably reduce your relaxed pause time by about 2 seconds or so. So I'm going to stop the timer soon because most people very rarely go past 30 seconds who are watching these videos at least. So we want to get that to about 30 seconds. So wherever you're at, take note of that. It's one of the most important metrics. And the reason we measure that, that is telling us how our body is with fast or regular breathing at night. The lower that number is, the more fast, the more regular our breathing at night is. The higher that number is, the better we're doing with slow, steady breathing. So 30 seconds is a necessary checkpoint before you try mouth tape. Second one is a max breath hold. And that is quite simply, we'll just do it together here because while we're here, might as well. This is a breath hold after a inhale, after you breathe in. This is the opposite of what we just did. The one we just did was exhale, breathe out, hold. This is inhale, hold. So we're going to inhale after I count to 3. We're going to inhale for 5 seconds, and then we're going to do a max breath hold together. So in 3, 2, 1, inhale for 5, 4, 3, 2, 1, and then hold. And I'm not just going to bore you for 60 seconds, but I will tell you that this is letting us know how your body does with hypoxia. Because the higher this number is, the better your body does with low oxygen levels. The reason this is important because if you're using mouth tape too soon, there is the possibility that you could be a little bit more hypoxic. Now, there's no evidence to suggest that. I always want to protect against this. And also, if you have sleep apnea and you're doing poorly and symptomatic, you're having hypoxic episodes at night. And the more we can increase this number, the more resilient your cells will be to intermittent hypoxia or low oxygen levels and swings. So that's why getting this number higher, because you may have started breathing a while ago, getting this number higher is a really big priority. So we'll keep going here. Most people, usually less than 45 is where most people are. 60 seconds is a good metric. So boom, right, almost got it. All right, so that's another metric you want to be at. So write down where you were. And then the next 3 are not going to be things where we just awkwardly stare at each other, is unilateral nasal breathing. So as part of your routine, before you do alternate nasal breathing, you're going to do the following. It's pretty simple. You're just going to breathe through one nostril at a time for 2 minutes in a row. All right. And then after you do 2 minutes here, switch. And that's it. And by doing this, this will be a sort of warm up, if you will, to help increase the amount of nitric oxide being produced locally in each nasal passageway, which will then make alternate nasal breathing a lot easier. So when you're doing your session, I would just do one breathing session per day. Start with 2 minutes on the left, 2 minutes on the right before you go into this alternate nasal breathing with a pause. This is different than what we talked about before, because when you pause here, this will help increase that relaxed pause time we talked about earlier. Okay, you can't see my other arm, but I'm pointing up to that. So alternate nasal breathing with a pause, pretty simple, very similar to what we did. So breathe in, and then when you hold, you will actually pause here and pause for a 5 count or a 10 count, whatever is comfortable-ish. You want it to be somewhat challenging. And then when you get there, then release, exhale, and then you inhale, Then pause again for 5, 10, or even 15 count, depending on where you are, and you do that. Do that for 10 minutes, cycle through that. And then once you do that, and it may be like, 1 to 4 weeks, really depends on each individual, then your test is very similar to what we talked about up above, but 10 minutes at a gentle pace without mouth breathing is going to be a good checkpoint. So once you're at all of these, then you can try out mouth tape. Only if you're tracking, because I want you to obviously make the best decisions for yourself. And again, if it's better, then awesome. Keep on keeping on, and then you can just enter in what we talked about with weaning off. If it's worse, then you just continue to improve on these checkpoints. You may need to get to 40 seconds here, or 45, or a 90-second breath hold. Just keep on going on with that. Now, if you have a CPAP, just some real quick recommendations to help facilitate less mouth breathing, more nasal breathing. A nasal pillow mask is going to be helpful. Practicing nasal breathing when you have a CPAP on is going to be very, very important. You don't need to do it the entire night. Just practice it for like 10, 15 minutes. And another thing that you want to work with your healthcare provider on is reducing the CPAP pressure to a safe place. Sometimes a lot of people are overpressured, I find. Like they might be at 10, for instance, and they can have the same AHI readings and sleep quality at 8. You always want to go in the minimum effective pressure setting on a CPAP. And once again, obviously I want to remind you all that personalized approach is key here, especially around these aspects. This is not going to be a one size fits all. You're going to have to learn what really works for you. But that's what this is all about, finding what works for you. And of course, to help you find the best things that work for you, I have 2 great options. So option 1 is having a lot of the things we talked about a lot more written out. Maybe take great notes and all that. That's fantastic. You just took what you need. If you need a little bit more in depth, I have a guide for you. I have everything I just talked about written out, the tables, etc. In this guide, the mouth tape and nasal breathing guide, a recap, little extra tips and nuances because I know sometimes information can get lost. I don't want to add too much in these episodes, and then some top myths, just giving you some confidence in what you're doing, busting those top myths there. Now, option 2 is to help you even be on a faster path here and help you have your own individual needs met at a little bit of a higher level than what we can do here. We have the Sleep Apnea Reset Protocol Workshop, which includes not only the workshop, but also our ebook, the Sleep Apnea Solution. And this will help you dive deeper into those individual factors. I'll walk you through some more tests because you may have some other issues with different aspects of your breathing. And that's what you can sift through and learn in that workshop where I guide you through a series of tests on different aspects and helping you craft additional components to your breathing exercises and being able to really have a very effective breathing routine. And also with the book, you get a good comprehensive resource that gives you other lifestyle mechanisms and other breathing practices to help accelerate your progress, improve your breathing at night so you're sleeping even better. So to get either one of these, how you do that, if you're on your phone, tablet, desktop, or TV here, it's pretty simple. So for the guide, all you got to do is click the link in the description. So if you're on your phone, you actually have to click the title of this episode just beneath it, and that will make the description appear. And once you're there, you just click that link. That's as simple as it gets. It'll say a sentence like this. If you're on your desktop, it should be pretty simple. It might be obvious from the get-go. Now, for the sleep apnea reset protocol, there's probably a button some 30 seconds ago. I usually put up there when I actually talk about it. If not, you can just rewind that, or I'm pretty sure it's available the entire time underneath the video on your phone or on desktop. So you can just go ahead and click that there for you. So that's how you get either one of those. And to make things super duper easy, if you just want to go to a link directly, because maybe you're watching this on your TV or you're just far away from your device, for the guide, you can go to ochnow.com/tape. Or if you want the Sleep Apnea Reset Protocol Workshop, go to ochnow.com/reset. So nice and easy there. Now, if you're on your TV and watching from far away, I encourage you to come a little bit closer because I'm about to give you some QR codes for you to scan on your phone. How to do that? Great question. Get your phone. Step 2, access your camera. Step 3, you're going to point it at the QR code. You're not taking a photo. You're just pointing it at the QR code that I'll show you. And then a link will pop up. It'll look something like this. And then you just click that. Simple as that. So for the guide or the workshop, here are your codes. Let me put that on the screen so it's nice and scannable. So if you scan the box on the left, that will take you to the mouth tape and nasal breathing guide. If you scan the code on the right, it'll take you to the Sleep Apnea Reset Protocol workshop, or you can just go to the links that are provided there. Either way, if you're here, it's because you're a winner and you're taking great strides in your health. So, whichever option you decide to take, it's a decision that moves you forward in your health. So, thank you so much for watching. I'm Dr. Dylan Peckus, and I will see you on the next page.